Previously, prior to the COVID pandemic, we had a student who is looking at the immune responses, so how the body responds to malaria parasites. And so she's looking at what we call cytokines. These are markers in the body that show what is happening when someone is infected. And so at the moment, we have developed a protocol to try and see whether some of these mechanisms are translated or are seen in COVID patients as well. So we are trying to see whether people who, so the kind of immune responses that people develop are related to how they present clinically, to how whether they get very sick or mildly sick, or whether they don't even get symptoms. So we are trying to correlate this with the immune responses. We have support from ARES, and we also have some support from NIHR from the UK. And both of these fundings are sort of part of projects that were already ongoing before, and we've had the sort of, we were lucky to get these funders accept to redirect some of the funding to the COVID studies. So that is how we are sort of managing this sort of small studies. In terms of the people, so in addition to Jean-Paul Coutelier, who is the supervisor of this PhD student, and myself, we also have a team at the National Reference Laboratory who are supporting, and also the leaders of the Rwanda Biomedical Center, which is an implementing entity for the Ministry of Health. And we are also collaborating with some researchers at Liège and some researchers at the University of Edinburgh. The results, I can't say we have like data right now that we are able to analyze and tell the results, because we are still collecting the data. So the target, we are sort of targeting to reach at least 300 people to have a wide coverage of clinical presentation and also geographical distribution. So at the moment, on the side of the immunology, we have collected around 100 samples at different time points, because the target is to collect samples when someone gets infected, get detected or tested positive, and then we keep following the patient up to the 28th days. So we follow the patient for 28 days, but taking samples at 4 different time points, so 7 days, 14 days, and 28 days. On the side of the virus, because we are doing what we call sequencing, which means we are looking at the sequences, at the variants of the virus that we have in the population. We've managed to sequence about 47 sequences so far, but also with the collaboration with Liège, we've managed to do sequencing of 150 sequences. And at the moment, we are analyzing the data.